Hi, I'm Megan McCann, board-certified nurse practitioner and hormone specialist. I've been working with women in various stages of perimenopause, menopause, and beyond, and every time I get a history and they've been on some form of hormone replacement therapy before, it's almost always just estrogen and progesterone. And I think to myself, what about testosterone? Our ovaries make that too. Why are we only replacing two of these three very important hormones? That brings me to why I'm making this video today, to bust the myth that testosterone is a male hormone. Even some of the literature incorrectly states that testosterone is only a male hormone. Yes, men have higher levels of testosterone than women, but the fact is testosterone, which is an androgen hormone, is the most abundant, biologically active hormone in women. 95% of our testosterone is produced by the ovaries, with the remaining 5% produced by the adrenal glands. So naturally, as the ovarian function declines in perimenopause and menopause, we become deficient in both estrogen and testosterone. This deficiency contributes to the many unpleasant symptoms of menopause, which affect quality of life, but it also creates an imbalance, which puts the body in an inflammatory state and increases risk for chronic disease, which is exactly what we don't want. Testosterone is so important to optimal function that there are androgen receptors all throughout our bodies, including but not limited to our breasts, bones, lungs, brain, GI tract, heart, blood vessels, spinal cord, and peripheral nerves. What this means is that testosterone has a function in all of these areas, because whenever there is a receptor for a hormone to bind, it means there is a specific action, function, or purpose to be carried out. What it also means is that when a woman is deficient in testosterone, all of these organs and tissues throughout the body will be affected. So you might be wondering, if testosterone is so important, why aren't more women being prescribed it as part of their hormone replacement therapy? The reason is because the safety concerns related to high and inappropriate doses of synthetic testosterone and anabolic steroids have been unfairly applied to the safety of bioidentical testosterone therapy. In fact, testosterone therapy has been shown safe and effective in the treatment of menopause symptoms since the 1930s. We can no longer let the myths and misconceptions from misleading data and false conclusions surrounding testosterone therapy for women prevent us from getting the treatment we need and deserve. Because at 50% of the population, women are suffering unnecessarily. And as healthcare providers, we need to do better. We owe it to our female patients to stay current and practice evidence-based medicine. And as a patient, you need to demand better. Testosterone is vital for optimal health in women in all stages of life. When dosed appropriately for the purpose of hormone replacement therapy and perimenopause, menopause, and beyond, testosterone will not masculinize a female. It will not lower her voice, harm her liver, increase clotting factors, or make all her hair fall out. In fact, about 2/3 of women have an increase in scalp hair regrowth with subcutaneous testosterone pellet therapy. Testosterone is essential to build and maintain lean muscle mass and essential for mental health. It is cardiac protective, and it protects against breast cancer. Testosterone is also superior at relieving pain, which, if you didn't know, is the #1 symptom of menopause. So let's stop excluding testosterone from hormone replacement therapy for women, because the combination of bioidentical testosterone and estradiol more closely mimics our body's youthful function and does a better job at relieving the symptoms of perimenopause and menopause. Whether you're a patient or a provider, my hope is that you question the status quo. If you are a patient and you'd like to learn more about how functional medicine and hormone replacement therapy play an essential role in your goal of achieving optimal health, click the link below to book a free discovery call with me. I hope you enjoyed this video, and if you're interested in more content about dissolving the myths around menopause and hormone replacement therapy, stay tuned.